Ability Inside Disability podcast is aimed at having conversations on learning, intellectual, and developmental disabilities. These conversations are geared towards understanding these conditions like autism, dyslexia, Down syndrome, and support for persons with these conditions and their families. On this podcast, we do have guests that range from teachers, psychiatrists, neurologists, parents, and even persons with these conditions themselves. We would very much appreciate that you share these videos so your loved ones and others can benefit from the content in these conversations. We appreciate that you like them, and we'll also suggest that you subscribe so you can always receive notification whenever other videos on these conversations come. On today's episode, we have an amazing guest. Actually, he's a return guest. He's someone that, life is of the place, and we'll be having a very, very serious conversations today. Today's topic is on sickle cell. Sickle cell and how it could bring about learning and even sometimes intellectual disabilities. So Dr. Bako is here in the studio with us. He's a neurologist with the internal department of the University of Jos Teaching Hospital. And he's been a staple on our program. And I hope you join us on this podcast and let's learn. Doctor, welcome.
Thank you very much.
So, what is sickle cell?
Yeah. Sickle cell is a disease and a kind of an inherited disease. It's one of the commonest inheritable disease in the world that has to do with, generally referred to as an hemoglobinopathy. There's this component of the red blood cells, they call it hemoglobin. So it's an inherited disease in an abnormality in the inheritance of that hemoglobin type. We have the hemoglobin that are different. We have the AA, we have the AS, and we have the SS. So the one without any abnormality is the AA. So sickle cell is when somebody inherits that hemoglobin that refers to as the SS type of hemoglobin. For people that have AS, refers to them as carriers, while the one AA is a normal hemoglobin. So sickle cell disease is an inheritable autosomal recessive disease that affects the hemoglobin of the red blood cells. And when that is done, because the hemoglobin in itself is the primary thing that traps oxygen, that leads to carrying of blood from one point to another, carrying of oxygen in the blood from one point to another. So when this hemoglobin that is inherited is abnormal, just like the one we see in sickle cell, which is SS, the ability of the blood to maintain its form, its shape, and even now carry oxygen from one point to another is now affected, and the subsequent things that will now happen as illness, which we'll talk about as we go further.
That's a lot to be experienced by one person. So the cell now is the primary basis of our entire existence, right? So if the cell is impacted by this whole genetic situation, how does this bring about conditions like developmental disabilities? Is it possible?
Very much possible.
Okay, so how can that happen?
Very much possible. Because, looking at because just like you're saying, a sickle cell, a cell is a functional unit of any living thing. So the red blood cell, whose functional unit activity has to do with the movement of oxygen, and in its entirety as a blood function can carry food and substance to other body tissue. So the movement of oxygen is the primary function of the red blood cells. Yes. So when there is an inheritable problem where an individual now inherited an abnormal hemoglobin, which is the SS form that now results to sickle cell. It means there is an abnormality in carrying the oxygen because the hemoglobin, which is the primary component of the red blood cells that is at least imbibed with that ability, you have the strong affinity for oxygen. Whenever there's abnormality in that inherited form, what happens is either as a result of maybe dehydration, as a result of stress, as a result of maybe an infection, ordinarily malaria, can now trigger that very abnormal hemoglobin, which is the SS hemoglobin, from what they now change their form, their activity function, and even their shape. That's where they become, that's where they get their name sickle shape. They now become so curved as a sickle. That's what they refer to as sickle cell. They now because normally the red blood cell is somehow rhomboid, much more circular. But when there is this stress, deprivation of oxygen, dehydration, infection, and the likes, that cells now becomes, they lose their shape. And whenever they lose their shape, the ability of that very cell to carry oxygen from one point to another is not impaired. And even because of that loss of shape, they now can even glue to each other. They can now at least, let me use a common term, they now agglutinate or gum to each other. And whenever they gum to each other, they now form what we refer to as a cast of red blood cells or sickle cells. And imagine this cast of sickle cells now going through a small blood vessel. They can easily occlude that blood vessel. They will block it. And when they occlude that blood vessel, with the fact that their shape is already abnormal, so they cannot even pick oxygen, as it were, the way they are supposed to have done it if it is a normal cell. So you see, they occlude blood vessel, they are not even picking oxygen in the first place. And so you see now oxygen movement from the red blood cells to a particular part of the body is now affected. So you see now the tissue supply will now be affected, oxygen is deprived, possibly even food following the occlusion. And those areas that is occluded become what refers to as ischemic. That's where these individuals that have sickle cell disease start having what we call painful crisis, because now there is no oxygen to the tissue start dying, and the pain that later on ensues with what they are experiencing. And with lack of oxygen too, when you don't have oxygen, it's like when they choke you, automatically oxygen cannot go from the lungs to the brain, or oxygen from the outside cannot go to the lungs. You see, what happened is dead. So the same thing, whenever the sickle cells now block small blood vessel, oxygen are not taken to certain areas. They are not affected. These individuals are now come down with painful crisis because of that blockage. They can now come down with even acute respiratory distress syndrome. That's where difficulty with breathing can ensue whenever that blockage happens around the chest. They can come with painful bone crisis whenever that blockage happens around the bones. And one of the commonest things they have, even when as they are growing up, that's where within 6 months to 1 year, that's where they notice that if this person has an abnormal hemoglobin, which is the SS type of hemoglobin, you now see them having what refers to as dactylitis, painful crisis around their digit. That's even one of the commonest things that people first of all see and notice that maybe this person might be having sickle cell. And another common thing again that we see with this individual is because this red blood cell, because they are now sickle, their shape and form is distorted. Most of them are liable to die early, because normal red blood cell is supposed to live for 120 days, plus or minus 3 months. But for sickle cell, within 10 to 20 days, they are dead. So automatically there's increased lysis, that's busting of the red cells, increased dying, and subsequent what refers to as jaundice, that most of these individuals, you see them, most times you see their eyes are yellow or greenish. So all of this will now culminate to whatsoever these individuals are having. So imagine all of this blockage within the lungs, within the red, within the digits, and the likes, even within the bone. That's where they have those crises. Imagine that blockage happening within the brain, because it does happen. Happening within the kidney, it does happen. If it happens within the brain, whenever those occlude, they block tiny blood vessels in the brain, come down with stroke. That's why most time if you see very young person, a pediatric case, somebody with stroke, pediatric case, it's either this succumbing to sickle cell anemia or otherwise. You have to first of all rule out sickle cell anemia. So this individual also have that occlusion. And sometimes they can even have silent occlusion.
Silent occlusion?
Yes, it might happen and you will not see fluoride, because normally, okay, let's say somebody is having a stroke. The commonest thing we see of stroke and what fits with the definition of stroke is sudden inability or blockage of the red blood cells, of the blood vessel, and with sudden inability to move a particular part of the body. A functional disability that comes suddenly following blood vessel occlusion. But for silent ones, because some of the blood vessels that are occluded are very tiny, these individuals keep having recurrent blockage that are not seen physically. Maybe there's a blockage in the brain, but there's no focal weakness that is visible to somebody that is staying with that person. So those things, it's happening inside. And sickle cell patients are the commonest people that have that kind of blockage. So imagine why you're brilliant is because one, oxygen glucose go to certain areas of the brain. So if there's occlusion happen, so there are cells that are dying. Imagine for a child that is still growing up, the brain is still developing, and you keep having this recurrent blockage. Brain development is affected, assimilation is affected, intellectual learning disability ensue. People like this can even have ADHD. All of this can now come in somebody with sickle cell disease. So these are the accumulation of problem because of these sickle cells that does not carry proper oxygen, that now align and agglutinate to each other and now go to different parts of the body and block the blood vessel. But as to be contextual, blocking cells in the brain, the small blood vessels in the brain. And on the long run, people like this, somebody can be at 30 years and start having dementia. You only see that in sickle cell patient. These are all neurological problems that they can have as a result of that very abnormality.
Okay. That's a lot. My people, that's a lot. I hope you guys are still with us. Please share this video, like them, subscribe as well, so you can continue to have access, notification to these kind of conversations. We really need to hear this. So, doctor, wow. See where you started from and see where you brought us to. That's really a lot. That must be a lot to live with as a sickle cell patient. So is there a way to avoid this?
No, it is one of, and as a matter of fact, it's one of the common avoidable abnormality, inheritable disorder. Primarily, it's premarital counseling. You're supposed to know what your genotype. That's why we advise that so long you're an adult, even children that are giving birth to, next thing that you want to do for your child is try to know the genotype of that child. Genotype is the genetic makeup of that particular child when it comes to all of these inheritable diseases. Because Nigerian, as a matter of fact, we're talking about 150,000 to 200,000 births of sickle cell disease in Nigeria every year. We have the global burden before the likes of maybe India and the rest. We have the highest all over the world of sickle cell disease. I'm telling you about 150,000 to 200,000 birth person with sickle cell disease every year in Nigeria until they, despite the awareness and everything. And I believe programs like this and all of this talk will also go a long way in helping people be informed, because the easiest way to avoid this is to know your genotype. Because automatically, if you're AA, you can marry. If somebody AS, you are not supposed to get married at all. Even if it is your village people that are advising you, you're not supposed to marry. Well, so talk less of somebody that is AS or SS marry or SSSS. That's not even a thing to talk about.
That's not even a thing
No, it's not a thing to talk about. Personally, funny enough, seated here, I'm AS.
Really?
Seated here, I'm AS. Unfortunately for me, our last child was sickle cell disease. So I'm talking from an informed position. Wow. Because I understand.
As a doctor, but as
yes,
a carrier.
As a carrier too. So
my wife is also a carrier.
She's AA. If she's a carrier, I'll lose my license. Now they'll tell you that I'm the most dullest medical doctor in the world, because I know what I see as a doctor, even as a family member that is taking care of somebody with sickle cell. And as a matter of fact, she didn't make it. She died on the long run while she was 10 years old. So you see, that's to tell you how severe this thing can be. So genetic counseling, genotype, when you know that AA can marry anybody. AS cannot marry AS. AS can marry AA. And that's the route that I followed. If I know that I'm beginning to like you, if I go back home, I'm thinking about you, the next thing tomorrow, I'll bring money for you to go and do genotype. Because I know what we undergo as a family, because we have somebody with sickle cell disease. So it's something that you wouldn't want even your enemy to have. So you try to see that you prevent yourself or any other person that is close to you to come down with it. Because most times, even as a doctor, in the best of cases, talk less of Africa, it's even poor here in our environment. Yes, thank God for stem cell transplantation and certain engineering, genetic engineering modalities that are coming into play that have shown significant output as regards care of these individuals. But then, it is never a substitute for you to to prevent that from happening. So AA can marry anybody. AS cannot marry AS at all. Talk less of AS and SS. SS cannot marry SS or AS at all. Highest if SS will just have to marry AA. So automatically, whatever they give birth to can only be carriers. And subsequently, the carriers, after knowing their genotype, they cannot marry a fellow carrier. They have to also marry AS. So genetic counseling
to make sure that
this disease doesn't happen, doesn't repeat itself.
In fact, the picture I'm having in my head is just the picture of a child who is experiencing developmental disabilities because not enough oxygen went into the brain. Then you give birth to this child anyway, and the child has sickle cell. This child now happens to be going through pain continuously, right?
Yeah.
Then because the blood cannot do its job well, the child will be jaundiced. And all of this can impact on the physical growth as well. Can the child not get stunted growth?
Why not? They have developmental abnormality. Okay, let's take it for example, for somebody now have, as a child growing up, now have much jaundice. Based on a particular range, jaundice for a developing child can affect the basal ganglia, a particular part of the brain, that result to what refers to as connectors. When jaundice is connectors, whenever the basal ganglia is affected, motor function of the child is affected.
That's movement.
Movement is affected. That's when people use those stigmatory words like the child becomes an imbecile. Because when he cannot control his motor and everything, because the basal ganglia is affected, and from what? Jaundice. So that's sickle cell, increased lysis of red blood cells, hemoglobin, and the rest are present in the blood. Jaundice can ensue, and whenever the amount of jaundice in the blood is too high, for a developing brain, they go and stain the basal ganglia. When they stain the basal ganglia for a developing brain, subsequently this person comes with motor abnormality. Cannot control his muscles, cannot control his head, cannot control his movement. That's what refers to as connectors. So all of this can happen with a child that is sickle celled.
Just because the father and mother chose not
They
to check
chose,
the
they say I only love them and see, but it's not always like that. You are supposed to first of all at least try and see your genotype. It helps strongly, prevents a lot of things along the line.
We shouldn't be this selfish because at the end of the day, the child is the one suffering.
It's the child that is suffering because he never bargained for this. It's your decision between husband and wife to bring him. So if you know that you are having an abnormality that during inheritance, because the chances is 1/4. That's 25% chance of every child birth for a person that is a carrier, two carriers marrying. There's about 25%. 25% is too big. 5% say we don't want to take that chance. Then 25%. So automatically in every 4 child that you're having, 1 is supposed to be a sickle cell patient. And I can tell you that sometimes the whole 4 will be sickle cell patients. Let's assume with each pregnancy, the chance is 25. Let's say that 25% is what keep presenting. Okay. So you see that all of your child might be sickle cell patient. I know of a patient, a couple of them. The entire family, the hip replacement therapy, the child, 2 of them have had stroke already. These are people that are not up to 20 years. 2 of them had heart stroke. One of them, there's one disease, because of occlusion of the blood vessel, we call it avascular necrosis of the femoral head. Femoral head, arthritis and everything. Somebody that is not up to 20, they've changed the hip bone, replaced it with metal. This is all as a result of sickle cell. Yes, when I sit down and counsel the parent, they never knew. They never knew that the painful part on their own, they went to do a test, they told them they're AA.
Which means there's also a problem with society.
So that's personally, I did mine, I did it twice. 2 different labs to see that at least when I see AS here, I say, okay, wait first. To the next lab, AS, then I confirm.
That's the advice now. Do it more than once.
Just do it more than once. 2 different labs, don't do it in the same lab. Sometimes you might see AS here, you might see AA here. Go for a tiebreaker. Go for the third one. Then that third one, you marry it with whatever you're having. Let the majority non takes. That's how you go about it. It's not a good experience. It's not a good experience.
So let's say now the situation has happened. What are the available support systems in place?
Yeah. Primarily, I think
for these patients.
Yeah, primarily, I think first things first is about, 1, knowing that, accepting the diagnosis, that medically for now, We don't have classically what we define as cure, especially in our African context, in as much as genetic engineering and everything is still, and stem cell transplantation are still out there to still help us. But then let's have the idea in our head that there is no cure to it. So automatically, it's about palliative care, managing these patients, trying to see that you prevent them, because one, they have immunosuppression. Their immune system is not that strong like the others, because the red blood cells in itself is not doing the function it's supposed to do.
So, doctor, we have established now that sickle cell could result to developmental disabilities, which intellectual can come in and learning can come in, because if the brain is not properly developed, it will be difficult for the intellectual growth, to set in, to be sustained, and learning too will be difficult, because in your explanation so far, it's in fact the condition affects everything about the person. So if this is the situation, and you've advised as well that couples should go for counseling before they get married, so they can be able to really, really go through the process of understanding their genotype.
Yes,
Is that the word you use? Yeah.
Very, very.
The genotype, so they can know if they actually, yes, that is the word now,
Genotype-wise.
if they are compatible genotype-wise. Okay, let's say now we have a couple that maybe they chose and believed more in love than process of clearing out this possibility, and a child is born as a result of this. And this child is going through all of the things that can possibly happen in the body of a person that has the sickle cell disease. What support structure is in place already for such a child, let's say in Plateau, specifically where we are at now, where you work as a neurologist, and what more will you suggest as a practitioner who has seen, all that there is to be seen, at least so far, when it comes to the impact of this condition, especially as it regards the brain and development?
Yes, there's no mincing word when it comes to what needs to be done, because this individual, as I earlier on said, because sickle cell in itself is seen as a multi-systemic disease, because it affects different areas. But then the brain is one of these common areas that it affects. And at least we've talked about how it resulted to some of those problems that we have in the brain. And for the fact that we have a hospital, or let's start from the hospital setting and healthcare-wise, individual with sickle cell disease, one, need a regular medical follow-up. They need regular medical follow-up. And even in the hospital setting, one of our best advice is that let them have their own clinic. Their own clinic is not because of segregation, because of time spent whenever they're in the regular clinic opening, because the stress, because other patients are there. Okay, let's say they have to be queued, and imagine a sickle cell patient being far behind. Maybe he comes to the clinic, say, earlier in the morning, especially in our government hospital setting, unlike maybe in the private setting. So these individuals should have their own clinic, so that the staying time in the hospital will be reduced. That goes to say there's a reduction in stress. Because stress is one of those things that even leads to more of the sickling that their red blood cells go into. So that staying time in the hospital should be reduced. So they should have their own clinic. And in some settings, they will have a routine for which they come to clinic. So time to so time, they give a particular time to so number of persons to come to the hospital, so that it prevents them staying longer in the hospital. And again, their follow-up is also one thing that is supposed to be regular. Because one, in their follow-up, there are certain medication they are supposed to be on. Yeah, things that, because we are in a malaria endemic area, and malaria is one of the common things that lead to frequent crises that most of these individuals have. Ordinary respiratory tract infection can lead to them coming down with crisis, but malaria is one of them. That's why they are always on prophylaxis for malaria treatment, like Proguanil is one of those drugs that they give them. Because again, recurrent lysis of their blood, they are also placed on folic acid. So something that will help regeneration of their blood, despite it being dead within a short period of time, unlike what we have of 120 days for normal blood cells, as against the 20 days for sickle cells. And also, looking at the school environment too, parents on their own should at least provide this very information to, even in the school where these individuals, it's not as if they are going to a segregated school. We're expecting them to have a normal school life, but then information about their health is something that the parents can give to the school administration, even to the level of the teacher, so that such patients, because absenteeism is much more common in them. It's much more common in them. So this individual, imagine after maybe having one crisis, you're not able to come back to school. And when you now resume school, the teacher of that very class is expecting you to be the same with other children that maybe have had their normal classes, have had their normal assignment, and they're expecting you to compete within the frame of that, despite you not being around when some of the classes are being taken. So such individuals should be given extra tutoring time. Extra time, which I believe some of our educators will talk about it when it comes to such issues. They should be given extra tutoring time, just like for individuals with some intellectual and learning disabilities. So things like this should be considered in the curriculum, even at the level of policy making in setting as a government through the National Assembly or State House of Assembly. Things like this should be considered in the education platform to see that individuals with these special disabilities should be at least factored in healthcare settings. So that the teachers will not see it as if, while I'm teaching other people normal classes, why do you want me to give extra time to this individual? You understand? So they should be well informed and educated, and it should be a policy so that this individual will not say as if they are doing extras against what they are supposed to do. So making it a policy at the government level and making it an important thing at the healthcare and family level, that even within the confines of brothers and sisters, they should know that this child had this kind of problem and shouldn't be at least managed outside the confines, because most of them, the pains, you don't expect a child that is having pain to be studying at that particular time T. You understand? There should be room for at least consideration and at least for taking care of that particular problem. You don't expect a child maybe in a sporting game that has sickle cell disease to compete favorably with other members of same age within that school. These are people that we say stress will not lead to crisis. So you see, automatically they have to be managed within a particular confine of time. If the other members of his class will go for an hour, they should go for 20 or 30 minutes. That should be that consideration. They should at least, or maybe have some resting time, even when it comes to studies, so that they don't push them. Like, I see people with sickle cell seizure disorder. I'll tell you, yes, you're a medical student, you have a seizure disorder. When your mates are doing all night, you're not expected to do all night. You should break your reading time, so that, because stress push you into crisis, stress puts you into convulsion. So if you're reading, your classmates are reading 4 hours, you do 1 hour rest, go for next 1 hour rest. So that consideration should also be placed on patients with sickle cell disease, because with that stress, they go into crisis, and that thing we're trying to prevent, that they are not learning very well, they are not present in the school, will still happen. So there should be moderation at the level of home, at the level of school, and even as a policy from the government, so that even the teachers will know that people like this should be given extra time. People like this should be considered in whatever we're doing, but then extra time should be given to them, so that they're learning an intellectual problem they're having because of the sickness that is preventing them to come to school, preventing them to push as against what their other colleagues will do. There should be room for consideration for such.
So, in the early part of the conversation, you said most times adults with sickle cell, they pass on in their 40s. And they go through all of this pain, all of this crisis, before they get to that 40, then pass on. Isn't there a possibility for them to do things they're not supposed to do to dull this pain?
Yeah, there's a possibility because of this recurrent painful crisis that most of these people undergo. And that's why you see significant number of people with sickle cell also have addiction problem. They usually have drug addiction problem. Like one of the commonest medication that they abuse is either tramadol or pentazocine. We have a couple of them that have to end up with the psychiatrist to help them cope that very urge, because it's not really their fault, because most of those drugs have addictive property. And sometimes when it comes to pain management neurology, you start with normal, and I'll just say, no, you will start with the likes of NSAID, the likes of paracetamols. Then you go to NSAIDs, the ibuprofen, amphetamine, the diclofenac. But when it's not working, that's when you now start bringing drugs that act on the central nervous system. Things like cocodamol that has morphine and paracetamol, others like tramadol, those ones like then pentazocine, those ones act on the central nervous system, they numb pain from the brain down to that very place. So that one, there's also an effect that it gives. There's this euphoric effect because of the release of dopamine with most of those drugs. So it now makes the person want to always take it, because it gives you this fun, this sense of happiness that is extra from what you're used to, and you want to always go back to it. And because you're always in painful crisis, you want to always take that injection, it now becomes so addictive that most of them, even if they are not in pain, they want to always take the injection, and subsequently they end up in a psychiatry, because without that drug now, before you say anything, this person might start having hallucination, down to schizophrenia and the likes, certain psychiatric symptoms, and they end up in psychiatry. So most of those things are things that can easily happen to them, because you have to always manage this pain. And as a matter of fact, even in these tertiary centers, we have to give them, because sometimes you give them ordinary paracetamol, will not work. You have to go, diclofenac will not work, and because some of the drugs like diclofenac, they have their own side effects, so you want to reduce it. So, but then the morphines, the likes of the pentazocine, those ones act centrally. They don't cause more effects on the normal body system, but then central nervous system, but then they have this addictive property. And most of them will come down with plenty of this problem.
Wow. And in all of this now, what would you advise? Because I really, especially because you said that it is something that can be avoided.
Yeah, it can be avoided, 100%.
In the first place. I really want to go back there, because if there is a way to avoid all of this pain, because this is pain to the third party now.
Yes.
Not the first two that decided to go into a relationship. Exactly. So please, I want you to reinforce measures that can be taken to avoid, because you said it earlier on too, that Nigeria happens to be the country highest, not even one of, the highest. So doctor, please, can you re-emphasize the importance of doing everything you can to avoid this situation coming to life at all, and the steps that can be taken?
Yeah, as a matter of fact, talking about preventing one coming down with sickle cell disease is one thing that one cannot overemphasize. I remember as a young doctor, as a medical, not even a medical, a house officer in pediatrics department, I can tell you for free that out of every 10 admissions, you see like almost 7 come with sickle cell crisis. And they are there. So seeing that, and again with my own experience as somebody that has a family member that died of that disease, if I see 2 individuals within the confines of this informative age getting married, I see them as demons, I see them as devils, I see them as very wicked individuals. Forget about the transplantation, forget about the genetic engineering. This is something that you would have been able to prevent. So please, the room for counseling, and at least premarital counseling, and at least genetic check for your genotype is of utmost importance. As in, you just have to see these children, how they are suffering, for reasons that are not their fault, because of the decision of 2 adults that choose to just push off certain information that was given to them and against whatsoever they think they want to do. So we are begging. I am begging. But we have this Ogun Foundation also begging that please and please, before you get married, go do your genotype. Go for marital counseling, do your genotype, and if you know you are AS and your partner is AS, no matter the love, the best of advice is sit down and talk through to each other. Because I can guarantee sometimes maybe my best of advice is go to a bigger hospital, tertiary center, sometimes just stroll to the pediatrics department. Go to especially where we call the emergency pediatric department. Almost every big hospital have it. Stroll inside. For the fact that 150,000 to 200,000 Nigerians every day give birth to children with sickle cell disease. 200 about. No, that number is something. So it's not as if we give birth to 150,000 this year, all of them will wipe out. Then next year we're having another 150. They are not wiping out. They are there. So we're just having that number every year. You understand? So the number is much. So we're begging. Because this thing is very, very, if you see somebody with sickle cell disease and somebody is having recurrent painful crisis, you wish not even for your enemy to experience that. So that's on the preventive part. The next thing, okay, let's assume these individuals don't have sickle cell disease. Like earlier on we've said, recurrent hospital, his clinic visit should be at least optimum, on point, ensure that this patient is well hydrated, because the whole problem that comes with the crisis, either just like I said, maybe an infection, malaria, maybe due to respiratory tract infection, maybe dehydration, stress induced. So all of these are things that you're supposed to cope, which is very, very difficult, that you are even a human being already. There are room for normal stress. So, but then you should try to see that you try to cope. These persons must be sleeping in insecticide-treated net. They should be on anti-malaria prophylaxis. Ensure that these people are well hydrated. If there's any symptoms, you go to the hospital as early as possible so that it doesn't progress to crisis. There are drugs that they give them to try and see that you are adherent to those medications, the folic acid and everything, because these individuals at every time they're in a state of anemia. That's why they will tell them, if any patient you see that is having sickle cell, ask, what's your steady state? Almost all of them, especially if they are grown up, they know. They'll tell them my steady state is 21. That's their PCV, their packed cell volume. Whenever I keep their blood, the amount of blood they have in their system is less than what other people have.
That's anemia.
That's anemia. And for them, it's working for their body system because the body have adjusted to it. Because they cannot even have much more than that. Sometimes even if it's much more than that, it becomes even cumbersome to them, because the body has adjusted to that low PCV. You see, most of the time they tell you steady state 21, 22, 23. You at least see somebody will tell you steady state is 30. And for us, again, 30 state, we're telling you that you are anemic already for normal people. At 30, we're telling you that you are anemic already. So we try to see that all of those triggers, all of those risk factors that will push them towards our crisis, we try to see that we curb them down. That is at the level of individuals that now already have sickle cell. And subsequently, especially as regards schooling and everything, that's where the government policy and everything come into play. Because if it has happened, there's nothing we can do, but we can just try to see that we make the life of this individual at least have a semblance of normalcy like any other person.
Audience, on this podcast, we focus on learning, intellectual and developmental disabilities. And for the most part, these conditions are conditions that come on because not, without plan. They come on because they come on. But sickle cell is different. Sickle cell is different because it is the intentional coming together of two people with wrong genotypes who end up giving birth to a child that will have to live with so much pain, so much stress, would not be able to develop properly, would not be able to learn like their peers, would not be able to live as joyful as they can, because everything ends up becoming so much struggle. So the things that we can avoid, let's avoid them. It's not just about us, the ones in love. Let's also take our time out to think about these other beautiful creatures that will be bringing to this earth. What exactly are we hoping for them? If you have a child with Down syndrome, it happened. The chromosome divided. Yeah? You have a child with autism, it happened. You have a child with cerebral palsy, injury happened. But this, you have AS, then you get married to another person with AS. It's not fair. It's not fair on the child. And it's not fair on you too. So, feel the pain, let it go, get married to somebody who would make it possible for you to give birth to a child that will be as normal as possible in spite of you being a carrier. So that at the end of the day, you live out your life with as much happiness as, is available, not deliberately putting yourself in difficult situation. And most importantly, making life miserable for this poor child, because that's our concern here, is the child. Because you're adults already, you can take care of your situation. But the child is now going to grow up with all sorts, including stunt development, inability to really reach their full potential most times. So, Dr. Bako, thank you so much for coming on to have this conversation with us, helping us understand how the sickle cell disease, how it impacts the brain, development, and every other aspect of growth. And I hope that our audience listen to this, they share this video, they like it, and they also subscribe, because for us on this podcast, we believe that these conditions are connected. You don't just become autistic out of the blue. You don't become this out of the blue. There is something that can be talked about, that we can hold on to help reduce possibilities where there is a chance, before we start talking about support when it has already happened. So we hope to see you on the next session of our podcast. Stay blessed.